Good afternoon, everyone, and welcome to our Let's Chat Immunizations workshop brought to you by Excellus BlueCross BlueShield. I want to start out today's webinar by thanking each of you for taking the time out of your day to join us here today for our August webinar that is part of our Excel Your Well webinar series, and we launched this in 2025 for our Excellus members. My name is Katie Keller-Burgess, and I am part of the Wellbeing team here at Excellus BCBS. So I will be the host for today's webinar, teeing up our guest speaker, Dr. Deanna McDonald, who will be presenting the majority of the content for today's webinar. So just a few housekeeping items to start us off with here today. Please note that today's webinar and all of our 2025 Wellbeing webinars are being recorded and are being housed on our Excellus BlueCross BlueShield YouTube page. So if you need to go back and listen to this webinar or maybe access a past or future webinar that you're not able to attend live, once again, you will have on-demand access to those monthly webinars right on our YouTube page. My colleague will actually plop in the chat the link to that page, once again, if interested in checking out any of the previous webinars. Another housekeeping item that I do want to call out is that all participants' microphones and cameras are automatically disabled. There will be time for questions at the end of the webinar with Dr. McDonald. So I do want to call out that if you have any questions at any point throughout today's webinar, please feel free to put them into the Q&A feature. So at the top of your team's webinar, you should see that Q&A icon. And once again, once you click on it, you are able to enter a question at any point, and we will get to them throughout via the chat or once again at the end directly with Dr. McDonald. And lastly, it is important to note that the content covered here today is meant to be educational in purpose. But of course, if you have any specific health-related question or concern, we do recommend that you connect with your primary care provider. Or if you have a specific benefit-related question or concern, we do recommend contacting that customer care number that's on the back of your health insurance card. All right, so with the housekeeping items out of the way, let's go ahead and learn a little bit about today's guest speaker. Dr. Deanna McDonald is a board-certified medical director supporting our safety net for the Excellus Health Plan. She holds a bachelor's degree from Nazareth College as well as a medical degree from the University at Buffalo Jacobs School of Medicine. Following medical school, she completed her pediatric residency at Women and Children's Hospital of Buffalo, now known as Oshai Children's Hospital, and also included her as additional year as chief resident there. Now, for the past decade and a half, she has cared for thousands of children. During her time in practice, she was awarded Best Practice, Best in Class, which truly recognized her efforts and clinical excellence in the delivery and quality of efficient care. Dr. McDonald joined the medical director staff at the Excellus Health Plan in the fall of 2022, currently resides in Western New York with her husband, children, and miniature golden doodle. Loves to spend her free time traveling, watching competitions and a variety of sporting events, boating, and supporting the Buffalo Bills. So with that being said, Dr. McDonald, we are so thrilled to have you here today. I will turn the stage over to you.
Thank you, Katie, and it's my pleasure to be here, and welcome to everyone. I hope we all learn a little bit of something today, and very excited to be doing this. Today I'm going to be talking about immunizations or vaccines. Going to touch on some basic vaccine information, the diseases that they prevent, the vaccination schedules. I'm going to go through common concerns or myths, if you will, about vaccines, trusted sources to turn to if you need more information about vaccines, and then we'll conclude with additional benefits and resources offered by Excellus. And so starting off here, vaccines, truly this is really one of our most remarkable scientific achievements and greatest health success stories of our lives. It is one of the best preventative health tools that we have for children, for adults. Vaccines are meant to reduce death and disease. They prevent spread and control spread of disease. And really, they allow people of all ages to live longer and healthier lives. Over the last 50 years, vaccines have saved at least 154 million of lives. The diseases targeted by vaccines are diseases that carry a substantial risk for serious illness and for death. We want our communities to be healthy. We want our children to be healthy. We want ourselves to be healthy. And so vaccines do that job. They protect us. They protect us from spreading preventable diseases to other people in our community. And they're recommended by every scientific authority: pediatricians, family medicine doctors, internists or adult doctors, OBGYNs, nurses, health departments, children's hospitals all recommend vaccines to help prevent disease and to keep us healthy. They're extremely effective in preventing disease, and they reduce death, and most notably, they reduce death in babies. And so sometimes it helps to understand the impact that something has by looking back at life before vaccines. And before vaccines were developed, before they were accessible to all, infections of certain diseases was universal, which means almost every single individual got these diseases that had significant consequences, whether through illness, but then even led to longstanding chronic issues such as meningitis, something called encephalitis, which is inflammation of the brain, and even death. Not only was there universal infection, there are many outbreaks of these diseases. And really what an outbreak is when diseases are occurring at rates more than the expected rate. And that means a lot of people are getting ill, a lot of people are getting hospitalized, and a lot of people are dying. And responding to an outbreak is not only costly in money, but it's also very costly in lives. And then worse off than outbreaks, we also experienced epidemics. And an epidemic is when an outbreak can't even be stopped, it can't be slowed, disease is spreading too rapidly throughout a community. And the picture here on this slide really exemplifies that. This is a picture that was pretty commonplace across the country. It's a hospital ward or floor with many iron lungs, and the iron lung was used to treat people who had polio. And this was commonplace. Epidemics of polio was commonplace. Many people died from polio or suffered severe debilitating consequences. Nearly all people were infected with measles and pertussis, especially children. Tens of thousands of children were hospitalized every year from these diseases, and hundreds died. Outbreaks of diseases such as diphtheria and smallpox, which many of you may not even know of, were common. And so vaccines were developed to combat these diseases. And it helps to know like what happens in your body when you're actually exposed to a germ, if you will. So the germ can be a virus, it can be a bacteria, but regardless, it's a foreign object that is like entering into your body. And when a foreign object enters into your body, your immune system kind of takes over. It recognizes as being foreign, something that shouldn't be there, and starts going to work. And there's many parts to our immune system, but when a germ or a virus or a bacteria enters our body, the immune system starts revving up to send certain cells and make certain antibodies to help fight off that virus or bacteria. This takes a little bit of time. And so while the body is trying to recognize it, figure out how to get rid of it, you're still exposed to that virus or bacteria and you're getting sick. That's why you have symptoms, because it does take some time for the immune system to recognize it as foreign. Once it does, it makes other antibodies that will stay in the body and will remember how to fight off that virus or bacteria. And if you're exposed to it again, it kind of takes care of it a lot faster because it doesn't have to go through the whole process again. Vaccines mimic our body's immune system. They essentially do the same thing. However, when you're getting a vaccine, you're only getting a very small piece of an inactivated or a weakened germ. So an inactivated virus or an inactivated strain of a bacteria. That small piece is put in our bodies, and our body's like, hey, this is foreign. And so it does the same thing, our immune system. It makes antibodies to recognize it, get rid of it, and antibodies to remember it. And so if in the future your body is exposed to that real virus or to that real bacteria, they've already seen it, but they've seen it through a very smaller inactivated form. Another very important concept about vaccines and immunity is something called herd immunity or community immunity. And so when you are getting vaccinated or your child is getting vaccinated, you're not only protecting yourself, but you're also protecting them and you're protecting your community. And this graphic really shows the importance of having a majority of the community protected. Ideally, to not see a disease that causes a lot of problems, you need 95% of the community to be vaccinated for most diseases. If you look at the first column in the picture here, you see a lot of blue people, which are the non-vaccinated or non-immunized people. They're healthy. And then you see two red people who are non-immunized, but they're sick and they're contagious. And when they intermix with the healthy people, you can see a majority of that population now becomes sick and contagious. In the second column, you have now yellow people in this community, and they are immunized, but you still have a lot of not immunized people. And so when two sick people enter it, again, a majority of the community is getting sick. In the final column, now what we're seeing is mostly everybody is immunized. There's a couple of people who are non-immunized, and then the couple of sick people. And what happens is that most of the community stays healthy and only one additional individual gets sick. And you know, there are people who truly cannot get certain vaccines, whether it's because they've had an allergy to a certain component in the vaccine, or they have weakened immune systems and they aren't able to have them, such as people who have cancer. They don't have the ability to get vaccinated. So keeping up that herd or community protection is really also important for those individuals as well. Here on this slide is a list of all the diseases that there have been vaccines developed for. Not all of these are on the current recommended schedule. Some are more applicable if you're traveling to other countries. But we do have a lot of vaccines to help protect us against a lot of serious diseases. Yet, we still see vaccine preventable diseases today. Why is that? A lot of the reasons why we see these diseases are related to each other. There are decreased vaccination rates. That is for a variety of reasons. Whether it's people have lost trust in vaccinations and the spread of misinformation through health inequity. Not everyone has access to health care. There's barriers sometimes to traveling to appointments. And another reason is that we live in a global community. We don't just live in a bubble in the United States. In fact, every single year, 37 million people arrive to the United States from other countries. Other parts of the world do not have a healthcare system like we do. There are vaccine preventable diseases that are still causing epidemics in those parts of the country. They don't have access to vaccines, and they travel here and they're bringing those diseases with them. And so it's again very important to remember that we do live in a community that's not just in our own local communities, but in a global community. And what we've learned, vaccines work. They do the job that they're set out to do. And the job is to reduce disease, it's to reduce death, it's to keep people healthy. This data was pulled from a report back in 2019. And as you can see, the vaccine preventable diseases are in the left here. The first column of numbers is how much morbidity. So, how much serious health consequences, death was occurring, tens of thousands, sometimes up to 100,000 cases a year. And following vaccination, the percent decrease that we saw was almost 100% in most of these diseases. And so, again, vaccines are very effective and they work at preventing disease and death from these diseases. So yes, it's important to get vaccines, but it's also important to get them on a recommended schedule. You want to make sure that your child, yourself, is getting the right protection at the right time. The schedule is the way it is because it was studied that way through multiple scientific studies, looking at the evidence, looking at the vaccines, looking at certain vaccines, how they're given together, and really when a child or an adult is going to be most vulnerable to have the most serious consequences from that disease. And so really any delay in not following the recommended schedule leaves your baby, your child, yourself vulnerable to a disease. And here in the next couple of slides are just graphics of the current recommended immunization schedule. This first one is broken down from infancy to 6 years of age. The next one is broken down from 7-year-olds through 18-year-olds, so it covers that adolescent, that teen period. And finally, for adults, and I'm just going to pause here briefly, just because, I think a lot of times, and I'm also probably a little biased because I'm a pediatrician, we focus vaccines and immunization talk around children and babies and teens. However, it's really important too for adults to be up to date on their recommended immunizations. Only about 1 in 5 adults are up to date. So it leaves many adults vulnerable. It leaves their families, their communities vulnerable to disease. And adults actually are more prone to already have other underlying chronic health conditions. And having a lot of those chronic health conditions puts them at risk for more severe consequences from vaccine preventable diseases. And so, we want our adults to stay healthy just as much as we want our babies and our children's and our teens to stay healthy. We want to keep them out of the hospitals. And so making sure as adults we too are up to date on our vaccines is really important. All right, now going to tackle some myths, concerns. A lot of these are really the most common questions or concerns or discussion points that I would have with my patients in the office. And a concern that a lot of parents would have is that are vaccines really safe? And vaccines are safe. And really, when we want to look at something safe or not safe, we're really talking about, does the benefit of something outweigh the risk? And you can look at anything in life where there's some risk, right? There's a danger in really everyday activities. Some interesting statistics is that every year 5,000 people die from choking on a piece of food. 350 people are killed every year from a bath or a shower incident. And every year 50 people are struck by lightning and killed. But really, none of us would never say, well, we're never taking a shower again. We're never going to eat anything. We're never going to go outside on a rainy day. because these are unsafe activities because someone has died. We just kind of assume like the benefits of being outdoors and going out to a restaurant and enjoying the food we love far outweighs any risk. And the same with vaccine. The risk of there being a serious adverse event is 1 in 1 million doses. So extremely, extremely low risk. The common things that can occur with the vaccine, pain, little bit of redness, little bit soreness at the site where they put the injection, sometimes a low grade fever for a day. But truly the benefits outweigh any of these risks. The risk of getting some of these diseases, we're could be, right? Fever, a rash, cough, but really what can happen to a lot of people is you can get pneumonias, you can end up in the hospital, you can need a breathing tube, it can go to your brain, cause something called meningitis or encephalitis, seizures, and then death. And so really, truly vaccines are something where the benefits of the diseases and the consequences they prevent far outweighs the risk. They undergo rigorous safety testing and monitoring. And really, that is something that starts at the beginning stages of a vaccine. And so, before a vaccine is ever tested on humans or even comes into the doctor's office or into the pharmacies, they're developed in a lab and they're tested in a lab, and at those points they're already looking at, okay, what's the best dose? Is the vaccine safe? What is happening in the lab situation? When they deem that that is safe, it then goes on to trials with human volunteers, and that goes through several phases. And again, all these questions are being looked at. The United States has a long-standing safety system to ensure that vaccines are safe, and it's partly because it's such a long process that is well studied, well monitored, and goes through many scientists before it ever comes to be given to the communities. Here is a great graphic. It kind of goes through the vaccine life cycle. And really in the orange to yellows is those pre-lab kind of testing, looking at the safety until you move into the greens and the blues, which is where it's going into clinical trials, going through then other safety regulatory bodies that are studying it, looking at it, the dosing, again, the side effects, and then when it even comes out to be given to members in the community from doctors, from pharmacists, safety is still being looked at every single day. And there are many systems in place to have that continuous monitoring of vaccine safety after they're out and being administered. And it really reaches all parts of the healthcare model. There's systems for patients to report safety concerns or side effects. There's systems in place for clinicians, researchers, scientists, as well as, for health plans that actually can look at safety through claims to monitor for any possible safety issues with vaccines. The next myth I'm going to discuss is natural infection is better than the vaccine. I don't know if any of you have heard of like the chickenpox parties or, in COVID, I did know people who were having COVID parties, meaning, okay, so-and-so in the neighborhood has the chickenpox, so let's get all the kids together at once and get them all sick at once. And there is a significant amount of risk when people decide to do that. And here, this kind of breaks down the difference between natural infection versus getting the vaccination or immunization. And so the column on the left kind of points to all the issues with natural infection versus vaccination with the column on the right. And so there is a high price for that immunity when you are trying to obtain it through a natural infection. And so, that high price could be paralysis, it could be brain injury, could be liver cancer, could be blind, could be death. The stakes are much higher and the risk is much more because the range of potential severity is more significant with natural infection. You can't predict who is going to be the one who just gets fever and the rash from chickenpox versus the one who's going to get pneumonia, end up in the hospital on a ventilator, and maybe even die. So the price for immunity is much higher with natural infection. You're also exposed to when such a significant larger amount of the virus or the bacteria. Again, vaccines contain a very, very, very small inactivated or weakened form of a virus or pathogen, bacteria. And that's because the vaccines are developed in such a way that to just give the smallest dose possible to generate that protective immune response. You can't control that with a natural infection. You also can't control when the exposure is going to occur for the most part. Vaccine, when it's going to occur, and it's meant to be given at a time when you're at most risk to have serious consequences for the disease. You can, unless you're having one of these parties, I guess, you cannot plan when you're going to get sick with a virus or with a bacteria, and that can be significant in terms when the timing is. And so previously, we looked at the immunization schedules, and, there were two broken down from babies to 6, and then children 7 to adolescents. And for a lot of the well baby visits, when the parents would bring them in, they would be concerned. They would have a question: is this too much for my baby's system to handle at this age? And that's a very valid concern. And really, what's important to know is that the minute a baby is born, they enter this non-sterile world that we all live in. From the minute they're born, a baby's immune system is challenged by thousands of antigens, or these germs, viruses, foreign objects, foreign things to their bodies every single day. A vaccine only has 150 immunological components, so much less than the thousands that a baby's immune system is challenged by. Their immune systems are extremely remarkable. They're born with enough antibodies to respond to 10,000 vaccines at one given time. And so if all 14 of the scheduled vaccines that are recommended for infants and young children were given at once, it's using only 0.1% of their immune system, which is very, very minimal. And so in saying that when your baby gets their first runny nose, their first cough, that is actually challenging their immune system more than all the vaccines given combined. Another question is that people are concerned with is what's in these vaccines. They're filled with chemicals. And so the graphic that I have here kind of breaks down what the vaccine recipe is. A vaccine only has the ingredients that are necessary for it to be safe and effective. It has the main ingredient, which is the active ingredient or the antigen. It's that small inactivated virus or bacteria or weakened form of it that is in that vial. You need something called adjuvants because that actually helps the virus or the bacteria, the inactivated form of it, work better and generate that immune response. Antibiotics are in the vial as well, and that's really to prevent like a secondary contaminant bacterial infection, because you wouldn't want that when you are injecting that into your skin. There's something called stabilizers. Stabilizers help keep the vaccine effective. And then there's preservatives and then trace components. And one of the most, I think, talked about preservative or concerning preservative was the thimerosal. And thimerosal was actually removed from all childhood vaccines in 2001, which is more than 20 years ago. Adult vaccines, for the most part, do not have thimerosal in it. There are still some multi-dose flu vaccines that do contain thimerosal, but you can get single-dose flu vaccines that do not have that. Another myth is that vaccines cause autism. And this is truly a myth. Yes, parents are concerned about vaccines and autism, but there is no scientific evidence to support this. This originated back in 1998. A gastroenterologist or like a stomach doctor looked at a group of only 12 children and claimed that there was a connection between the measles vaccine and these children having autism. This study was disproven, not only done through like multiple well-controlled studies, looking at millions of children repeated over and over again. But then when other scientists and other researchers went back and looked at actually how this doctor did the study, it was not done in a scientific manner, and the article was taken out of the journal and he actually lost his medical license. But since then, it was question posed, and like anything in science, it's been studied over and over and over again. And what has been found and what's been consistently found is that vaccinated children develop autism at the same rates as unvaccinated children. The follow-up to that is then, okay, then why are so many children being diagnosed with autism? And really back then, a few decades ago, to make a diagnosis of autism, you needed to hit 8 criteria out of 16 possible criteria. So your child met 8 points in this criteria, and then they were given a diagnosis. Now there's only 2 screening questions to make a diagnosis of autism. Also, 30 years ago, we weren't routinely screening for autism. Autism developmental screens are now parts of well visits, really from birth on, with autism of focus typically between 9 to 18 months, 2 years of age, and then 2.5 years of age. So routine screening, recognition of signs of autism, really is now the standard of care. And it's important that it's the standard of care because early recognition of autism, early referral to services really can make a difference for these kids. Also, 30 years ago, you needed to go see a specialist to get a diagnosis. Now this diagnosis can be made by a pediatrician. All right, so where to go for more information? Most people will go to the internet. Tips of websites to look for. You want to look for websites that end in a .gov or a .edu. You have to be careful with .com, .org websites, and of course, social media. Social media is a big realm of information for people, but it also contains a slew of misinformation. Misinformation can spread very quickly. Information on social media altogether spreads very quickly. There's no filter for accuracy. It's based on algorithms, which based on where you pause and where people are clicking the most. And so we have to be really careful with what you're reading on that and if it's true or not. A research study actually looked at social media back a few years ago in 2021 and found that 65% of all social media anti-vaccine content came from only 12 people. And so really being careful about what you're reading and what you're looking for, it is important. And That is why your doctor, your child's pediatrician is really your best source of any questions or concerns. We welcome them. We want to have these discussions with you, and so yes, please go look up information, but come with questions. Come and talk about it with your doctor. That's what we're here for. I put some other sources here of where you can find some vaccine information, but really I encourage everyone to always speak to their primary healthcare provider. They're going to have the best source and know you and your family the best and help provide you with reliable information. And so wrapping up here, my end, I hope everyone here has learned a little something. You can walk away feeling that you maybe have some questions answered about vaccines or you know where to go for that information, but that really the message that vaccines are one of our best healthcare success stories, one of the best pieces of medicine that we have, that they are here to protect everyone from babies to adulthood to our elderly family members, from disease, from hospitalization, from lifelong disabilities and death. They're truly one of our greatest achievements. And what, I am a pediatrician and I am a mom. And I would always tell my parents I would never recommend something for your children that I wouldn't recommend for my own. And so, all three of my kids are vaccinated. They're all doing very, very well. They're young adults and late teens. And so, I just hope everyone here has learned something and I appreciate your time and your attention. Thank you.
Awesome job, Dr. McDonald. Thank you so much. I myself always learn something new whenever I hear one of our medical directors speak. So thank you so much for that. I'm going to take control back here and pivot a little bit to some related benefits and resources that are available through the health plan for our members to help take advantage of when it comes to this topic. So the first thing I do want to call out is our Find a Doctor tool that is available, whether it be through your Excellus BlueCross BlueShield online account or the mobile app. You are able to, with this tool, find doctors within your plan, be able to compare cost, even budget for possible expenses. So once again, with this tool, you're able to search for doctors, specialists, urgent cares, hospitals, other facilities, filter those results by specialist, languages spoken, whether the provider is accepting new patients, and more. So, once again, a great tool to be aware of if you are looking for care, whether it be a primary care provider or a specialist. And we do recommend logging in to make sure that the results are personalized to your specific plan. I also want to call out our care management team here at the health plan, who is comprised of a variety of healthcare professionals, such as registered nurses, registered dietitians, respiratory therapists, and more. And they are all a team that is here for our members whenever you need us. So, whether it be from little health questions all the way to big health challenges, our care managers can support members of all ages at no added cost. So you're able to connect with our care management team via phone, via email, or another great option is the WellFrame app, which can be downloaded for free and provides that direct connection to that care management team to receive support and or guidance for conditions such as substance use, depression, anxiety, high blood pressure, weight loss, smoking cessation. Once again, a lot of great tools, resources, and direct link to that care management team. I do want to call out the access code for WellFrame if you decide to download that free app is Excellus Welcome, all lowercase, all one word. And then lastly, wanted to highlight Blue 365, which is an online marketplace where our members are able to save money and get discounts on health and wellness related items such as fitness gear, gym workouts, gym fitness centers, nutrition deals, and more. So you're able to sign up for Blue 365 for free and once again access any of those deals and discounts. You can find Blue 365 underneath the Health and Wellness tab if you log into your Excellus member portal or go directly to blue365deals.com. So with that being said, once again, I echo in thanking everyone for taking time out of your day to join us here today. Before we move into questions, I want to give a plug for our next month webinar, part of that Excel Your Well webinar series. So we will be focusing in on support for mental health and substance use disorders in September with Dr. Stacy Elliott, another one of our medical directors, who is a board certified psychiatrist as well as an addiction medicine physician. She will be covering the intersection of mental health and addiction, understanding substance use disorders, treatment option and resources, support for maybe someone, whether it be yourself, family member, friend struggling, and more. So, once again, my colleague Kate did just put in the chat the link directly to that registration if interested, or this QR code once again if you want to take out your smartphone, scan that QR code, you're able to get to that registration form directly as well. But feel free to share the registration link with any friends, family members, coworkers, once again, anyone you think may be of value for this upcoming topic. So with that being said, let's dive into any questions that have come through. As a reminder, in that Q&A at the top of your Teams, there's a Q&A feature if you enter. So let's see here, Dr. McDonald, we do have a couple questions that have come through. What are the 2 screening questions for autism diagnosis? Do you have any insights there?
So there are two main questions, and I don't know them obviously by heart, but they are asked typically how it's done usually in most offices. Like a parent will get a developmental screen, and there'll be like a question that's like, do you have concerns with the way your child talks or moves or looks at things? And then another question is how they're interacting with their environment. And then the most common one, which you've seen if you've been in an office with your child, is the questions that look at, do loud noises bother them? Are they saying these words? Do, certain things like this. It's something called the MChat, and certainly that's available online to look at those questions. But if you get a score of like 2 positive answers, that's a flag for like more in-depth questioning. And so with that in-depth questioning comes follow-up questions, and then really we pretty much have a good sense if a child might be autistic. Still like them to, and we can start a referral. We don't want to just right there put on their assessment like this child has autism, because some things we do need some further evaluations, but we could if we needed to, I guess. So
Thank you.
kind of doctor dependent. But
Yep.
again, we repeat those questionnaires quite often because not every child develops at the same pace, I should say too. There are 9-month-olds who are walking, and there's children who don't walk until they're 16 months old, and there's nothing wrong with that. So there's a range.
Absolutely. Yep. And I think just ongoing with those preventive screenings, I myself have a 2-year-old, so I'm consistently filling out these developmental forms.
Yep.
But those consistent touch bases with the provider to recognize or call out, any concerns you as a parent may have. So great call outs there. Just based on time, we'll get to one more question. We had someone say that, every fall when myself and my children get the flu vaccine, the COVID vaccine or booster is always mentioned that it's a personal choice, and they are finding most people are still getting the flu, but majority are skipping the COVID ones. Any thoughts around the possibility of why there?
Well, I think there's a lot of media attention to the COVID vaccine. And so I can't say for sure why certain people are or are not, but what I can say is that seasonal vaccines, flu, COVID, RSV for babies are still the recommended vaccines. And so really if you're unsure if you should still get a COVID vaccine, or if you should get a flu vaccine, or if your baby needs an RSV vaccine, really those are good conversations to have with your provider, your pediatrician, your own doctor. I think, touching back to the other question and what Katie just mentioned, that's why we want everyone getting in for their regular well checkups. Obviously, for babies and children, it's more frequent, but adults, it's every year. And so really keeping up to date on that is really important. And because that is when vaccines are given, that is when you can ask these questions. Um, you know, I wish I could give you an exact reason why not everyone's getting their COVID, but I suspect it's just because of some misinformation. And really, you want to address those concerns with your doctor. So,
Absolutely. Great way to end it. Yes, primary care provider, pediatrician, like you said, really the go-to for any specific questions. But once again, we are right at time. So thank you, Dr. McDonald, for all the information, expertise. Thank you, everyone, for joining. We hope to see you at next month's webinar, and I hope everyone has a wonderful long holiday weekend. Thank you all.
thank you.